Don't forget where we at, man. Commish Radio, yeah.
Boom, no chase how we say, but we want rum. Up in here, they beg we to chill while we calm down. Up in here.
All right, we got the elephant in the room discussion about mental health awareness. Right after this song, all right, here we go. This is how we finishing.
Up and up and up, up and up, up and up. When you see we hands gone up and up, up and up, up and up. Everybody hands gone up and up.
It's not just a question this week, man. We're having a full discussion. Let me know what you think.
Certain for this, certain is what all we know. Certain for this, certain is what all we know. You want police, mash up is what all we know. Let me see you put your hands in the air right now and push them up and up and up, up and up, up and up. When you see we hands gone up and up, up and up, up and up. Everybody hands gone up and up, up and up, up and up. When you see we hands gone up and up, up and up, up and up. The press go.
Elephant.
Yep, good to go.
I don't want to talk about that.
Well, we don't need to talk. I just want some.
DJ Ronnie Styles, boys. You're not rocking with DJ Ronnie Styles.
We have a very, very special guest today. I have a very young, fly, amazing expert in the mental health field. As a feature for our mental health awareness month. I'm just gonna introduce her. Well, I'll let her introduce herself because she has too much of a resume and I'm not good at reciting lines. So I'll just let you take it from there. Go on ahead.
Ron, you flatter me. So hey guys, I am Chardonnay. I am a professional in the mental health field. My credentials so far is I am a mental health. My credentials so far is that I'm a mental health intern, which means that I'm identified by the state of New York as someone who can provide counseling to people as long as I have a supervisor or a licensed person in the state of New York over me. So I am not necessarily a black belt, if you will, in the profession of mental health counseling, but I can explain at the most basic level what mental health counseling is and kind of dispel some false beliefs about what therapy is.
Yeah.
And just give some basic information on top of that, give you some information on how to find a good counselor.
Yeah, absolutely. So, first of all, men, she's taken. All right, so fall back. All right, we're not gonna be sliding in her DMs. All right. We're just gonna get that out of the way right now. All right. We spoke. You mentioned a lot about mental health, right? And this is the month. So tell me, in the most basic of terms, what is mental health?
Okay, so mental health is being aware of your emotions and feelings and the things that you're doing. So what I mean is people do go about life doing things without it being in their awareness. Mm-hmm. So the purpose of therapy is to have someone to talk to honestly. And I want to emphasize the word honestly about your thoughts and feelings, right? The therapist acts as a guide to help you find for yourself a better way of handling situations that may be holding you back and not helping you move forward or maybe frustrating you. So just kind of giving light to some of the things that may be holding you back. Now, there's various ways that a therapist can do this. And they call this their theoretical orientation. And I know you were thinking, what does that mean?
Totally.
So your theoretical orientation is the way you go about helping a person, and there's a lot of them. That's why when you look up on a website on finding specific therapists, they might be cognitive behavioral,
Yep.
Emotional regulation, DBT. The way my focus is on psychoanalysis, or I'm being trained in psychoanalysis, which means identifying things that you may be doing unconsciously out of your awareness and bringing it into your awareness so you can make the decision if you want to change that behavior or not.
Got it. I mean, you mentioned like coming and just seeing, all of you experts, and getting an understanding of, your emotions and all that stuff from an honest perspective. Are there clients that will be coming up in there lying, and are you guys even like able to figure that out? Like, would things just not add up?
Yes, and just like in any conversation, if your friend is telling you a story and like don't make sense,
Wow.
if you're a good friend, I hope, then you would call them on it or ask for clarification. So we are not, what do you call those people? We are not mind readers, though.
Yeah.
So we don't always detect that. That's why honesty is the best policy, as much as we can in the therapeutic process.
Makes sense. So, I mean, if we're gonna be real right now, right? I'm Black. I'm a Caribbean man. I don't think there's anything wrong with me. Yeah. And I don't want to, in my head, all the way up until very recently, because mental health awareness has definitely increased over the years, right? And improved, but I just don't think I'm crazy. So I don't think that what if I'm one of those people that don't think that I need to see somebody? If I could just go buy a $10-12 drink at the bar and then feel better after. Does it mean that I'm crazy if I'm actually seeing somebody?
So I get that a lot. I get that a lot. You're not classified as crazy if you're seeking therapy. And how I want to explain that is, let's look at the definition of what crazy means. And I just looked it up. It says mentally deranged, especially as manifested in a wild or aggressive way.
Right.
So that's the picture we paint inside our mind, and relate that to going to get help. That I have to be to that extreme, wild and aggressive, in order to get help.
Right.
And that is not correct. There's various reasons why people get help. Mental health is extremely common, because the most extreme cases are publicized, like serial killers,
right,
sociopaths, sex offenders, things like that. Because it's so extreme and publicized, we understand that those people need help, and I'm normal.
Right. I'm not as bad as them.
Yes.
So I'm normal.
Exactly, but you have to think of it as to some degrees of it, and people need help in all aspects of the spectrum. And then I'll get to later on I'll get to various ways or dispel some common false beliefs about mental health. But you're not classified as crazy if you ask for help. And a lot of parents, I get this as well. Maybe you're not crazy at all. Why are you seeing that person, once a week?
Right.
You're my perfect little angel.
Right.
So a lot of us get the have excuses not to go, and we believe that in them. But if we really think about it, like that definition I just gave of crazy, it doesn't match up. So
Definitely.
at the most minimal level of mental health conditions can be helped in a therapeutic environment, if that makes any sense.
Absolutely. So with that part aside, right? How do I know if I should seek some mental health, a mental health professional? Is there anything that, are there signs? Is it just something that's like a good practice to have? Like what are some things that I guess a person should maybe check for, so on and so forth?
Okay. So the most basic answer is that everybody can benefit from counseling. I mean, your problems don't have to be extreme for you to get counseling. But a common thing I see is that when I tell people I am a counselor, they go into telling me the most personal things ever, and it doesn't matter what environment we're in. I can be in P.F. Chang's and I can tell someone I'm a counselor, and they will tell me their most personal secret.
I hope you send them a bill after, right? We don't do freebies anymore.
The first one's free.
So nice.
But what was I saying? So, if you are that type of person searching for somebody to listen and to hear you, then that is a definite sign that counseling is important. You might have a friend or a loved one that you talk to when, things are going wrong or when you have a problem, but they have a more biased view of it.
Yeah.
A therapist can see things at a more objective level, see some things that I don't say you're doing wrong, seeing some ways how you're miscommunicating, seeing how the other person is communicating, and help you really look at yourself in the situation.
Right.
So, if you are looking for someone to talk to and, going around and telling everybody it, and they're not really offering any valuable feedback, then a therapist is a place to go. Also, feeling a specific symptom for most of the day, every day, is a definite sign of a mental health condition, which is not a terrible thing. Right? So, I mean, if you feel anxious for most of the day, every day, that's a sign of a mental health condition that you need a professional to help you with. If you're feeling depressed for most of the day, every day, that's a definite sign that you need a professional to talk to help you with these things.
What about someone like me who just likes to be busy all the time? Like I don't like to just not have anything to do. Except for when I go on vacation, I guess.
You're a hard worker, Ron. Well, what can you say about it?
I try. Not like you, but I try.
What do you mean? Tell me, how is that an issue for you?
I mean, so let's say that like okay, like maybe okay. So I just lost my dad on this month last year, right? In
Yeah.
May on May 1st last year in 2020, and since then and maybe before, but like since then, I definitely found that I can't sit and watch TV as long. You know what I mean? I can't just like be twiddling my thumbs. Like I feel like I just need to be doing something with my time to kind of like feel like I'm being productive, feel like I'm just accomplishing something, and maybe just I guess not to think about like the issues that like obviously would have come up now that my dad has gone. Um,
Yeah.
so like yeah, I just like to keep myself busy, and I had nowadays I have no problem, working, at nighttime. I have no problem opening my work laptop on the weekends, stuff like that. If I'm just at home, not doing anything.
Yeah, I wouldn't say necessarily that's an extreme problem, but that's something, if you want to figure out why you do that behavior, seeking help and counseling is the best way to go
Got it.
and make sense of it and understand it.
Right. Right.
And understanding that smoking and drinking
Uh oh. Uh oh.
is not a cure to anxiety or depression.
No.
Say that. I'm gonna say that one more time. Smoking and drinking is not a cure to anxiety or depression.
Oh man.
It is only a band-aid. And what I mean by that, yes, you don't feel depressed or anxious, or I'm going to go back to anxious. Yes, you don't feel anxious when you smoke weed, unless it's like really good shit. But
Oh yeah.
I'm sorry, I don't know if I can curse.
You're good. You're good.
Yes, you don't feel anxious when you smoke weed, but that is only for a temporary amount of time. When that wears off, when the high comes down, eventually that anxiety comes back.
Yeah.
And that's where the evil monster of addiction is. It's always chasing, blocking out whatever it is that's bothering you. Anxiety, fear, grief, trauma, all of that. So, it's not a cure. Talking about therapy is important. I mean, talking in therapy is important.
Got it. Got it. So,
Another thing I wanted to bring up on that topic is those psychotropic medications, what we like to call it, which is things that help you with mental health, like how they're advertised, like Prozac, Wellbutrin, Xanax, things like that. Things that say that will help with your anxiety or depression or things like that.
yeah, and then like the whole rest of the commercial is talking about possible side effects that you may have. It's like they talk about the good things, for like 2 seconds, and then the rest of the commercial, which is like another like 5 minutes. It's and they be talking fast too, man. What's up with that? So you don't even know what they're saying.
So here's the thing. I don't have a bias about these medications. And there is an obligation to tell you each and every one of those side effects. So you can't say you didn't say anything about it.
Right.
But here are my thoughts on medication, in my opinion, because I'm not going to say this for every therapist or psychiatrist. In my opinion, those medications are to help stabilize you so you can be more receptive to talk therapy. In other words, it's an adjunct to the therapy process.
Yeah.
So an example of that would be if I am so anxious and keyed up and tense and I'm sitting across from a therapist, and they are trying to talk to me about or talk to me about what's going on with me, I'm not going to be able to concentrate because I am so anxious. I can't focus on anything. So the medication will help me calm down and relax a little bit so I can be more receptive to what's going on.
Yeah.
So I can actually talk about the problem.
Right.
So as I'm doing this, while I'm on the medication, we slowly wean off and see how we do without it over time, because I'm able to talk about my problem now. So because I'm talking about my problem, the anxiety is subsiding a little bit. And the same thing for depression and trauma and things like that, if that makes any sense.
Absolutely. Okay, fair enough. So at least as long as you're like mentioning all side effects, you're clearing all avenues, then it's fine, it's recommended, it's totally okay.
Yeah, so if all your hair falls out, you can't say we didn't say that we told you about it.
If my hair falls out, I will come and fight you, your boss, everyone in your office. It's still, I personally will still blame you.
Yeah.
That's beef.
Yeah.
So,
Go ahead.
So, final couple points, but like Black mental health awareness, right? I think overall, in our community, I definitely feel like we're a much more like against seeing professional help, as opposed to actually getting it. Even though the awareness is out there, it's still another step to like actually go and take out the steps to carry out the steps to actually go and see somebody, right? So like, what would you say to someone like that? Especially when you think of all the things that's going on right now inside the country, outside of the country, all over the place for Black people. We just know that things are just a bit more difficult than it is for our as opposed to like our other counterparts in other races. What would you say to people of the Black community specifically?
What I want to say is that there are people out there to help you with what's going on. That you are not alone in how you're feeling. And a lot of the community, it's feeling isolated from the outside or everyone else. And it's perfectly understandable based on the history of this country and other places as well.
Right.
But in 2021, it is different practice to seek help. Another thing I wanted to talk about in relation to this is the race of the counselor that you see.
Oh, okay. Yeah.
A lot of people seek out or want to seek out counselors who are the same race as them because they feel they would be understood more. And I totally and completely support that and understand that. But I wanted to let you know that seeing a counselor outside your race is also helpful as well. And the reason why is that they drum multiculturalism or cultural competence in your head from undergraduate school. A good therapist, at least.
Yeah.
So you do not get your license. You do not get your bachelor's degree. You do not get your master's degree unless you understand cultural competence. And what that means is clearly understanding that people have different cultures of you, and how culture relates to certain issues, and knowing what those issues are. The main thing is, as therapists, if we're seeing someone outside our race, is that we don't assume based on ethnicity or color of their skin. We ask questions.
Yep.
Right? So if I'm Jamaican, you're not going to assume that I smoke weed all the time because I'm Jamaican, right? Because I'm a culturally competent therapist.
Right.
I will ask questions rather than assuming. So, that being said, my counselor and mentor is a Jewish man in Brooklyn, in his late 50s, and he knows me better than anyone else.
Yeah.
So, that being said, it is possible to see someone outside your race and get the help you need. Shout out to Dr. Michael Fishman.
Nice. Go ahead and Google it. Find the guy, all right, everybody?
Yeah. So yeah, it is harder. A lot of people of the Black culture are somewhat against getting help. But the main thing what I do want to say is that there is help out there.
Got it.
Yeah.
Awesome.
A few more things that I wanted to say are that my mentor would kill me if I didn't say.
Okay.
Do you have time, or are we good?
We got 5 minutes.
All right. I'm gonna make it quick.
Okay.
So what I wanted to say is that anger is everything. And what I mean by that is that it is really an epidemic in this country and amongst many people that people do not express their anger in an appropriate way.
Yeah.
Think of anger as sand in an hourglass, right? When it flows down to the bottom, think of the sand as our anchor. So when it flows really down to the bottom of the hourglass, we're expressing our anger in an appropriate way. Say, for example, hey, I don't appreciate that you didn't wash the dishes. It makes me feel angry because it feels like you're not listening to me. Right?
Yep.
That's how you express your anger in a constructive way.
Yep.
So imagine something blocking the middle of that hourglass. So the sand, wherever it's coming from, dark matter, it just forms out of anywhere.
Yeah. Right.
Just for the use of this example. So if something is blocking that sand flowing through, it either explodes through the top of the hourglass, or it shatters the glass. When it explodes through the top, that means we're not expressing our anger appropriately. So everything builds up.
Yep.
Being pissed off about the dishes not being washed, not talking, not standing up for yourself, just not being direct on what you're upset about, pushing that anger down. It explodes through the top, and how is that manifested? Through violence, through fighting,
Hurtful words, like just everything that just shouldn't be happening.
Yes, out of control anger, accidents, gun violence, and it leads to a lot of violent things. And that's all from not expressing anger violently. Another way it does is, like I said, the glass shatters.
Yeah.
And when the glass shatters, think of that as your body, right? So the sand builds up, your anger builds up and attacks yourself, attacks your body. This causes cancer, high blood pressures, MS. Um,
Wow.
uh,
Wow.
I'm trying to think of the other things, but those are the main ones. It causes a lot of mental health issues. We're also finding that it causes late onset Alzheimer's, things like that. It can manifest itself in many different ways. So, what I wanted to get out is anger is everything, and in order to learn how to express that, it's not a negative emotion. In order to learn to express that in a constructive way, therapy is where it's at.
Wow. Okay.
Yeah.
That's a big one. That is definitely a big one.
Yeah. So there's definitely personal and even global effects to counseling. Is that if everybody got some kind of counseling or therapy or help or something like that, we can make this world a better place.
Makes sense. Makes sense. Are there like as we close, are there any like websites or like any places that you know of that are good maybe to get started, like maybe some questionnaires or surveys that could be filled out that might, kind of bring, have you at least thinking about taking that step forward and seeking professional help?
Yeah, for sure. So I'm really kicking myself because I didn't get to how we find a good counselor, but maybe that can be for a later time.
Yes, absolutely.
But there's a good website called Psychology Today, where you can specify to your geographical area, whether you want a man or a woman, LGBTQ sensitive type of counselor, their race, everything. You can specify what exactly you're looking for in a counselor on that website. And I'm not a sponsor of that website, but I find it's very helpful.
Okay, awesome.
Also, another resource is you can email me at professionalme0123@gmail.com, and definitely there's some I can send you some good resources there.
Nice.
Yeah.
Nice. Those are the two. Wait.
Those are the two I have so far. As far as finding diagnostic type of things, I would leave that to the professionals. There's a lot of Cosmopolitan magazine kind of things online.
Yep.
That I wouldn't put 100% of my trust in. But at a basis, if you're feeling a certain feeling that's bothering you on a daily basis, that's the indicator that counseling is the way to go.
Understood. Well, we definitely want to thank you for your time, and we're absolutely bringing you back without a doubt, because this is just too much good information that I just feel like we just don't hear often enough.
I have so much more. I'm kicking myself I didn't get to, but I got to the important part. So
okay, awesome.
Yeah.
And I when we bring you back, we'll absolutely run through some of those points again, and you can get to some of the stuff that you missed. So it still works out perfectly fine.
Yeah, for sure. I'm glad I got the word out. The reason why I got into this field is because I know people can be better and live to their higher potential. And emotional intelligence is the key to living a better life. So I want to help as much people as I can to get there.
Appreciate that. And I mean, just to go off of that, I know like mental health awareness is still like, even though like the awareness is spreading, it's still very underappreciated, and it's just not known of enough. So we're gonna keep pushing, at least from where we can.
Yeah, for sure, definitely. I agree.
All right, Chardonnay, everybody.
Thank you, guys.
Thank you.
Yeah.
All right, and cut.
Commish Radio.